My name is Amy Powell. I'm Community Engagement Specialist for the Pheo Para Alliance. I'm also a Patient Advocacy and Advisory Board member. I started my advocacy journey about 10 years ago when my mom was diagnosed with pheochromocytoma, which is a rare neuroendocrine cancer. As I began to seek others who were affected by these tumors, often described as being the rarest of the rare, I almost immediately found Miranda Edwards and her blog, Pheo versus Fabulous. Miranda describes herself as terminal and thriving. After being diagnosed with pheochromocytoma at age 19, she was misdiagnosed with anxiety and 4 years later was told that her original tumor had metastasized. This journey led her to create Pheo versus Fabulous, a blog that manages to give readers an honest and unflinching look at life with multiple cancers, including metastatic neuroendocrine cancer, while promoting positivity, self-acceptance, self-love, and self-care. Over the years that I've known her, Miranda has transformed Pheo versus Fabulous from a blog that I found into a brand so strongly linked to her that many call her by that name. She's blossomed into an ardent and effective advocate, spreading much-needed awareness about Pheo Para and other neuroendocrine cancers, and insisting that the management of cancer and other diseases include considerations of the patient's wishes and quality of life. Please join me in welcoming our first speaker, Miranda Edwards.
So I want to start with a quick poll of the room. I would love to know how many of you have been impacted by pheochromocytoma or paraganglioma. Raise your hand. we have a few people, so I'm not the only one in the room. That's what I wanted to make sure of. And how many of you are impacted by cancer in general? How many of you are living with or have had cancer? Okay, so there's a few survivors in the room. So only if you're comfortable, I'd love for you to close your eyes and think about how many of you at this moment have hope. And I know that's a personal, honest question, but I'm curious to know, are we feeling hopeful in the room? Yeah? We have hope? We're feeling hopeful? Okay. So I'm not here to explain the science behind nuclear medicine. I'll leave that to the experts. What I am here to do is offer a human perspective behind the medicine, the thing that connects us here all in this room today. And in the cancer community, I think, from my experience at least, we can feel really isolated at times. Whether it's because we feel like people don't really get it, like truly get it. And it's really hard to feel hopeful when you have nothing to pull from. So you have no one else that you can see. And in my case, I didn't know a single person that shared this disease upon diagnosis. So if you can relate to that, I really hope that you'll remember my story. And I really hope that it can be what helps you find hope in yours. So I've been living with pheochromocytoma, diagnosed for the last 13 years. And I was first diagnosed when I was 19 years old. I had just suffered a heart attack, an unusual thing for a 19-year-old woman to experience. And it was a really long process to the diagnosis. So it was months of hospitalization, endless tests, and finally, we got this result back, and I had lethal amounts of adrenaline in my body, which explained the heart attack and led me on my road to a full diagnosis. At that time, it was said to be a 1 in a million tumor. It was very rare. And it was also said at that time that it was benign. So although dangerous in some ways, it was not cancer, and that sort of false sense of security set in. And I went on to have surgery which we do when we have a tumor that's found. But I suffered a complication, and the main artery to my heart was nicked. So I bled out, and I spent 3 minutes on the operating table with no pulse. Blood transfusions, broken ribs, every measure to restart my heart. We went into life-saving mode, and although I am so grateful that they saved my life that day, I would have no idea what that complication would cost me in the future. But surgery is curative, they said, and it's benign. It won't come back. Tell that to my recurrent symptoms. I was experiencing the same heart palpitations, the high blood pressure, the profuse sweating, all of the things known with a pheochromocytoma. And this time, I would be told for years, over and over and over, that it's not possible and that I'm just anxious. So at 23 years old, just 4 years later, is when I finally received a diagnosis of a metastatic recurrence. At that time, it had spread to distant organs. It had spread all over my abdomen. And I was, in the same breath as this recurrence was confirmed, I was told that the disease was terminal, that they could no longer cure it once it had metastasized, and they gave me a 1 to 5 year prognosis. I'm 33 today, and I'm still here, still fabulous. Thank you. I made a promise to myself shortly after the diagnosis, once the dust settled. I made this public proclamation that Pheo would never take away my fabulous. And all that means is I won't let cancer take away who I am, the things that make us who we are. I would never let it take away my hope. That complication during surgery, it caused the tumor capsule to rupture. Something we didn't know at that time was it allowed the cells from the tumor to seed into my abdomen, making the perfect environment for metastatic disease. 13 years ago, the standard of care was to use MIBG nuclear imaging after surgery to see if all of the disease has been taken. But with a cellular level, it was not the correct scan at that time. We would not have seen something so small. And this is why nuclear medicine plays such a vital role at every stage of our diagnosis. The lesson I learned very early on was that you need an excellent team. So I started to gather mine. We took a breath. Most often, we jump into surgery, everything's so quick. Keeping in mind, I'm just told I have over 50 metastatic lesions in my abdomen. I've been given this horrible prognosis. It's spread to my liver, so now they're saying I'm on the poorer end of that prognosis. So the instinct is to act quickly. But my new team said no. So we want to slow down. Before we do surgery, we want to utilize nuclear medicine to gain as much insight into your specific disease as possible. With metastatic disease, we have to collect as much data as we can. And we're still using that initial data we collected 10 years later. I won't sugarcoat this. Treatments were incredibly difficult for me at this time. I did a 6-year straight course of experimental treatments, one after the other. And I didn't seem to respond the way that the community was. I didn't have the same reactions. It wasn't really adding up in a lot of cases. And the first treatment that I did ever with metastatic disease was called MIBG. So we knew I was avid, we knew that my tumors responded to this, and so we decided to go into the treatment. But I was the first patient at this hospital to receive this type of medicine. And understandably, there was a lot of nervousness, a lot of uncertainty, which is common for a rare condition. And what we learned during this time is that I am severely allergic to iodine, which is the main component in this therapy. I started to react to everything, and it was a mess. But the mess becomes the message. The treatment wasn't working the way we had anticipated, and unfortunately, my disease was progressing. So my team had to sit me down and really give me some options, hard and fast options. So one part of my team is recommending we do some newer immunotherapy. Another part of my team is saying we should do chemotherapy at this point. And none of these things were aligning with me. Like, none of it felt right. But there's already such little options within this disease for metastatic cancer. So I kind of thought to myself, what choice do I have? I either continue on with something that I don't feel right and I don't believe in that is right for me at this time, or I do nothing. And neither of those options really seemed good to me. So I started down my own path. I started to ask the patient community, what's going on with clinical trials? Is there anything available to us right now? Even if it's in Germany, like, what can I do in this moment? And this is what led me to a newer, at that time, scan called gallium-68. The only issue, this scan was in clinical trial. They were only accepting 50 patients from all around. And your tumors had to be avid. So clinically, at that time, with the information, that data we collected earlier, it was telling us that I would not be receptive to this type of imaging. So why would they accept me out of 50 people to do something that wasn't going to work? But all I could think about is, if I am receptive, I am going to be able to then go for a treatment trial. I'll have this whole new option available to me. So I challenged what we knew. The information that we had available to us at this time was that this scan had a much higher sensitivity level, and it was going to become the new gold standard for NET cancer. This was a pivotal moment for me in understanding the power of self-advocacy and the power we have over our own care. I pushed for this scan, my endocrinologist backed me up, and we thought, this is possible. I got accepted after a lot of persistent begging from my husband, and my tumors lit up. I was fully avid for this treatment. It was incredible. We all learned something that day. We don't always fit into a box, and if we push, we can sometimes get the results that are necessary to move forward. And interestingly enough, there's only one type of therapy like this available to metastatic Pheo patients today, and it was that trial. So off we go, 8-hour drives every 8 weeks to do this PRRT treatment. Until one day, we received a phone call, and I was removed from the trial. There are specific timeframes and very strict rules when it comes to a clinical trial. It's not personal. It's just my disease was not improving in the allotted time that they had, and so I was removed. It was as simple as that. My husband, I overheard him on the phone with the doctor, and I could hear the doctor saying, "It's time to just keep her comfortable." My palliative care team subsequently recommended hospice, which would have translated, in my case, to about 3 months or less. And I don't know how to explain how I knew this, but my instinct was that I was not dying. I didn't believe it. I didn't feel I was in denial. I just didn't feel that that was what was happening. So what did I do? I did what any reasonable person who's just been given this news. We sold everything we had and took an extended vacation to Mexico. But before that, just moments after I get this phone call, I felt compelled to record my thoughts, record my reaction. It felt like a moment that really mattered, and I didn't know if I was talking to my future self or somebody who's perhaps going to be in the same situation as me. But I said, as I'm starting to talk it out loud, I said, hope is the hardest thing to have with this disease. But I choose to have hope. I choose to continue to fight. I'm standing in front of you 10 years later, and I am reminding you that we are not a statistic. You are so much more than a prognosis or a diagnosis that's given to you. And I learned that we definitely don't fit into a box. As time went on, that treatment worked, which was amazing. It was unexpected. It's really hard to go through these difficult treatments at times when you're hearing these grim statistics and these prognoses being given to you. But I've learned that we can let it fuel us. We can let it be, knowledge is power. We can make our next choices and decisions based on that information given to us. And sharing our stories is what helps us to keep going. Later on, much later, we would identify the cause of my allergic reactions, the cause of why I wasn't responding the same way and in the same time as others. I was diagnosed with a comorbidity called mast cell activation syndrome. That changed the future of my care. I started to respond to treatment in a much faster pace, and my terminal cancer became stable after 7 long years. That learning curve has led us here. Each situation has provided us with a lesson to continue to go forward with more information. This is when we redefine the statistics. That limited data that we have available to us, those few articles that we have, our individual stories change those statistics. Most recently, I was diagnosed with metastatic thyroid cancer. My lovely necklace to prove. With everything we've learned, with all that we know now, after 4 negative biopsies, we were having a really hard time diagnosing this cancer, even though we knew it was highly suspicious and it was most likely thyroid cancer. So with my superhero team and all the information we knew, we decided to go for molecular testing. This testing allowed us to confirm that it was in fact cancer. It was able to tell us the genetic mutation before surgery. I was able to identify the variant of the type of cancer I have. This led to understand that it was rare, aggressive, and that we needed to act right away. So a much different story than the years that I led up to this. And I was able to get the life-saving emergency surgery I needed. I was able to have radioiodine therapy, nuclear medicine, right after the surgery, safely, efficiently, and it's working its magic as we speak. So, it takes a tremendous team effort, right? With this disease, with cancer, it takes a tremendous team effort. But I've learned that no one will fight harder for you than you will for yourself. If I could leave you with a couple of things that I would really want you to remember. You're never too rare, you're never too complex, and you are always worth fighting for. And although cancer can take all these little pieces of us, it can never take away your fabulous. Thank you.